What's up, guys? Dr. Jared Hall here, physical therapist in Fort Worth, Texas, and I wanted to share a pretty cool case study that I have with you guys. Right now, I'm treating a patient who's about 4 years status post knee replacement, and he's coming in to see me because he's got reports of pain, tightness, stiffness, and just an overall lack of range of motion in his knee. Right now, he's got about 107 degrees of knee flexion when measured cold. And after some manual therapy, some exercise, some warm up, some contract, relax, stretching, various types of stuff like this, he can get up to about 120, 122 degrees of knee flexion. Because of his consistent reports of tightness and gripping sensations and just a general feeling of awkwardness in his knee, I decided to test 2-point discrimination, and I compared it to his contralateral side. And what I found that in his affected limb, his 2-point discrimination was about 60 to 65 millimeters apart, whereas in his non-affected limb was about 40 millimeters apart, which is consistent with the normative value for the distal lower leg. As you can see, I have that written right up there. So we see that his symptoms are tightness, stiffness, gripping sensations, as well as some pain in his knee. So what I did for an intervention today was about 8 to 10 minutes of 2-point discrimination testing, where I poked with either one or with two paper clips is all that I used at different distances apart on his knee, on the medial side, the lateral side, inferiorly, over the patella, superiorly, all around his knee, and I had him determine whether it was one or two points touching him. And when he was incorrect, I told him what the correct answer was, and I gave him some time to integrate that into his mind. So after about 8 to 10 minutes of this, the patient jumped up, walked around, and reported that his knee felt better than it had in about 3 years, and that it actually felt like his knee again. We went and did a measurement immediately afterwards, and he got up to 125 degrees of knee flexion. And given this is a case study, it's pretty cool outcomes considering we didn't use any manual therapy, we didn't use any exercise, we didn't do anything other than the 2-point discrimination intervention. In that dramatic increase from 107, maybe even 110 degrees up to over 120 degrees is well outside the standard error of measure for goniometry. So we know that we probably had a pretty good statistically significant difference here. And this is just a great case study to show that maybe sometimes some of the pain and stiffness and guarding that we see in patients is more a result of cortical smudging and not having a clear image in the brain and the somatosensory cortex as to what the body is supposed to look and function like, and which leads to some uncomfortable feelings or possibly even guarding and altered function. So I want you guys to give this a try. You can try it anywhere in the body: shoulders, backs, necks, everything. Knees definitely work well, and see if you have some good results with it, and let me know about those, and post any questions you have in the comments section down below. Thank you guys. Have an awesome day.